Been a patient of Dr. Luchikowski since, it was October 5th was when I had my surgery, 1998. I was very lucky. I had very few problems following. It took a little while for me to know exactly what I could wait after a period of time. I was very well instructed by doctors, so it went pretty smoothly. I felt very fortunate. I started out with my weight. Well, let me back up. I went to about 2 or 3 months of going to classes that he presents very well because he's an excellent teacher. I believe at one time in Warsaw, he actually taught at a university. I could have some of that information incorrect, but I think so, and he is an extremely good speaker. He is a very good educator, and anyone who goes to any of his classes, which I strongly suggest before and follow up for a period of time, is going to feel very, very fortunate. It's because his teaching methods are beautiful and you are well educated as to what he has done and what he will do in the future. My weight was 274 when I started out, and it really didn't take me quite a long while. I did not wish to go fast, nor is that really recommended that you go quickly. My goal weight was actually could have been higher than what he and I discussed. I thought about 120. He really at that time did not think that was necessary, but I'm older. Will be 71 very shortly. And but I got down, I wanted to keep my weight right around 120. I am presently and have been right around 115. Once in a while it goes down a little bit. I really don't get over 120. And my thing is to keep things in moderation but very healthy. I crave protein, and I think protein is extremely necessary in this program. Also keeping in mind that you have different things that you should eat that are healthy, keeping in mind that greasy foods, fat foods may not always agree with you, but your next stay in the bathroom will tell you that. You have to use common sense. The main thing is to think of this as not just for appearances, which is always a good thing, but that it is recommended that you keep in mind that it is most important to keep a healthy lifestyle, and that you want to do this to keep yourself going for as long as possible. I have a lot of arthritis. I am very arthritic, and I had a husband who passed here recently, and so I had a lot of things that I had to do. Does it excuse me from exercise that it has been highly recommended? No, I guess not, but it kept me pretty darn busy. But I do highly recommend that you get in your exercise to keep your bones going, and you take it, very, very important that you take the recommended things such as your calcium and anything else that doctor has recommended to keep you at a healthy level, to keep your bones intact, and to keep yourself healthy. Basically, that's about all I can say. It's been quite a few years. My problems have been relatively few, but I am older. And as you get older, your needs change. And you have to compensate. But I am very, very glad that I had Dr. Luchikowski. I'm very particular about the doctors I go to. I research, I check it out, I listen to other people, I talk to other people. I listen with a very, very careful ear. I have been extremely satisfied with him. Wonderful doctor, extremely, extremely good surgeon. Once he does your surgery, and once he gets in there, you know that you are in good, safe hands. Thank you so very much.